Now, the next element is now going to be the investigation. When you're investigating this patient, the first thing that you have to investigate is to investigate the neuropathy. If you're in internal medicine, your diagnosis is different from in surgery. In internal medicine, your diagnosis is going to be instead you concluded on a polyneuropathy, a polymyopathy, or all that. So that's your diagnosis, with etiology being and then complicated by an arterial ulcer. That's how you see your diagnosis in internal medicine. In internal medicine, there is no chapter like ulcer. The chapter there is going to be polyneuropathy, polyradiculopathy. So you say you concluded on a neuropathy with an anatomic syndrome being a polyradiculopathy, polyneuropathy, this. Are you understanding? A mononeuropathy. Those are the syndromes that you concluded, and then you say it's complicated by this. So now, your disease is a neuropathy. How do you investigate for neuropathy? Clinically, is it clear? You can support the neuropathy just by dossier examination, lower motor neuron syndrome, and all that. Now, paraclinically, so to confirm your neuropathy, you are going to do to confirm neuropathy paraclinically. Is it clear? You do an electroneuromyogram. Is it clear? It is an electroneuromyogram. Is it clear? The electroneuromyogram is important because it helps you to detect the speed of the action potential. One, it helps you to detect the frequency of the action potential. It helps you to detect the muscle contraction tones, the amplitude of the muscle contraction, and also help you to detect the amplitude of the action potential. So those are the four things that on the action potential, it can help you to detect the frequency, the speed with the duration. It helps you to detect this frequency, the speed with the duration, and then the amplitude of the action potential. And for the muscle, it helps you to detect the frequency of the muscular contraction and the amplitude of the muscular contraction. Is it clear? So it can help you detect the action potential and then the muscle contractility. Here it helps you detect the speed or the duration. Is it clear? It helps you detect the frequency and help you detect the amplitude. Is it clear? And here for the muscle, it helps you detect the amplitude and help you detect the frequency of the muscle contraction. Now, this all together can help you to make now a diagnosis of a neuropathy. If you have a reduction in amplitude, in frequency, or the speed, all that is already are neuropathies. Now, the neuropathies now can depend on the etiologies. There are different etiologies now of the neuropathies. Is it clear? Now, you need to also know that what, depending also on if there is a problem on the speed, the frequency, and the amplitude, the electroneuromyography can divide a neuropathy into central neuropathy and peripheral neuropathy cause. As I've said, there are central neuropathic cause and there are peripheral neuropathic cause. Using the electroneurography with the speed, the frequency, and amplitude conclusions, you can say that it is central or peripheral neuropathic cause before now you go now into the next investigations. Now, let's say that you have concluded on central neuropathic cause. That's where you have now to investigate on the causes. Is it clear? To investigate now on the causes now, which are central, we say that the central are mostly related to the vertebral column. So here, the best thing to investigate at the vertebral column, you have to visualize for the tissues of the vertebral column. So the best is the vertebral column magnetic resonance imaging. Is it clear? So the magnetic resonance imaging of the spine. Is it clear? Or the location at which you have located that is this problem. Is it clear? So magnetic resonance imaging of the spine is going to best for soft tissues. Is it clear? But if you mostly want to see the bones, like in the case of spondylodiscitis, when you have a prostate cancer, you want mostly to see the bones. If you're thinking more of the things like discitis or disc prolapse, you are going to use more of magnetic resonance imaging. But if you're thinking more of the bones pathologies, like in metastasis, you are going to mostly use CT scan. Is it clear? Because CT scan will control, because CT scan is going to be much more going to have a bony window, a good bony window. Why? Magnetic resonance imaging mostly have a good soft tissue window to visualize well soft tissues. Now, the next thing after that now, after you have divided it to central with the electroneuromyogram, it is central. You have already done the test. Now you want to know if it is peripheral. So in peripheral, it can be divided into two. Is it clear? It is either it has penetrated through a nerve ball, or it is a systemic from auto antibodies. So here now you have to bring this one. When he has penetrated through a nerve ball, you have poliomyelitis. So to visualize poliomyelitis, you can do a biopsy of that nerve. Is it clear? To visualize poliomyelitis. So to confirm poliomyelitis, you're going to do biopsy, but to support, you can just do a serology of the poliomyelitis. Is it clear? Of poliovirus. Is it clear? Just serology of the poliovirus, and also a DNA testing, PCR, DNA test of the poliovirus nucleus. So all that is going to tell you that there is poliovirus, and then to confirm, you can do biopsy and then the DNA testing. DNA testing is for confirming. Serology is for the supporting. Now the next thing is herpes zoster. Herpes zoster, to support, you are just going to do this, the serology of the varicella or the human herpes type 3, is it clear? Which is still called herpes zoster. You do the serology, and then to confirm, you're going to do the PCR to visualize for their DNA. Still for the Lyme disease, you do the serology for the Lyme disease, and then to confirm, you're going to use now you're going to visualize the PCR. Is it clear? So those are the different elements. Now for the systemic causes, you can have autoimmune like Guillain-Barré syndrome. When you want to visualize Guillain-Barré syndrome, generally what you do is that you do a lumbar puncture and CSF analysis. But the CSF analysis of the in case of Guillain-Barré syndrome is very important, because there are certain immunoglobulins that you're going to identify. Is it clear? In the lumbar puncture, is it clear that immunoglobulins, and they are also, you also do the immunoglobulins inside the blood. Is it clear? And by doing the blood electrophoresis. So you need to know that what to support Guillain-Barré, you can just start by doing blood electrophoresis, because there's going to be a picture that the Guillain-Barré syndrome is going to present on the blood electrophoresis because of excessive production of certain immunoglobulins. I understand it. But now to confirm, you have to confirm those particular immunoglobulins now against the Campylobacter jejuni in Guillain-Barré syndrome. Is it clear? And also, you have also a method of confirming from a CSF analysis and the blood immunoglobulins ratio. There's a certain ratio that you have to calculate. Now, for amyotrophic lateral sclerosis, in order to confirm there's amyotrophic lateral sclerosis, you still have to do electroneuromyography. And when you do electroneuromyography and you have an involvement of at least 2 areas of the spinal cord, it means that the diagnosis is amyotrophic lateral sclerosis. Meaning that what? Meaning that for amyotrophic lateral sclerosis, the problem is still going to be central and not peripheral. Sorry. So when you have another central problem, it's also amyotrophic lateral sclerosis, because I've always been emphasizing that amyotrophic lateral sclerosis only affects the motor nerve from the spinal cord. So diagnose amyotrophic lateral sclerosis, you need to know that this is the spinal cord here. It extends from the cranial part. Let's say that is the cranial part of the spinal cord. This is the thoracic part. This is the lumbar part. And this down here is the sacral part. Now, when you have, let's say you have a central disorder located here, and you have a central disorder located here, at least involving 2 areas of motor neurons only. Is it clear? It is amyotrophic lateral sclerosis. When you have a central disorder located in 2 regions, is it clear, of the spinal cord. So this is cervical, thoracic, the lumbar and the sacral, located at least in 2 regions, only involving the motor neuron. It is a diagnosis of amyotrophic lateral sclerosis. So that is how you can make a diagnosis of the cause. Now, for the complication, you have to diagnose now each of the complication that you have to do. Particularly when you have the autonomic nervous neuropathy, you can still find those complications clinically by supporting, and paraclinically you confirm by using still the electroneuromyogram that is going to have effect now on the sympathetic nerves. Now, the next thing after that now is the management.